Hello everyone. Today I will be showing soft cataract in two different situations. Both the surgeries are unrated, and as you can see, this is a grade 2 cataract. The first surgery is on a lower magnification, and in this case I used dye to stain my capsule. However, dye was not really required because the glow was good, and after staining with dye, the main incision was made. These cataracts are tricky in the sense that at times you make a trench, but when you try to hold, you end up eating that piece and you are not able to maintain that hold. So, Rexis was made with the help of Utrata's forceps, and as you can see, the Rexis was completed easily. These are the cases where actually there is no thrust, and after injecting visco in antechamber you are able to continue with the Rexis easily. After doing hydro and tapping in between, visco was injected, and then gentle dialing is what is all required. And probably you are not able to dial, then either hydro is incomplete or you are not engaging the nucleus properly. With phaco probe, I go inside the anterior chamber and start making a trench which should be small and deep, because as then you'll have an ample lens material in front to hold. And this was a soft cataract, but see, I was able to hold and crack. And similarly, other pieces were cracked, and see how fast it could be once you are able to maintain that hold. And then each pieces are brought in the central safe zone and emulsified. And as I said in my last video, the role of chopper in soft cataracts is actually very limited, as when you create pieces it becomes very easy with the phaco probe to emulsify such pieces, and power required is minimal. And as you can see how easily all pieces were emulsified. Now only few cortical material was left, and then at this point I go inside with my irrigation and aspiration cannula and continue with my irrigation and aspiration. As you can see, Rexis is visible nicely, although at times I go through the main port, but this is not recommended for the beginners, as there is a risk that you might catch the posterior capsule. And after removing the whole of the cortex, at times you require to polish the capsule also, and you should remove every bit of cortical material that is left, as then this becomes a clean surgery, and next post-op day you get a clear cornea with no or minimal inflammation. Now I am rubbing the capsule, and the parameters are vacuum 10 and aspiration 10, and you should gently rub the capsule. And if there are any fibrous components, then you should not be aggressive in removing them, and be gentle in your movements, especially for beginners. Then under hydroimplantation, the lens was implanted, and with the help of irrigation cannula it was depressed and placed in the bag. Now you can see very well the IOL was in bag with Rexis margins visible. And these are the cases where actually a good Rexis can be achieved even without the help of femto. And since the hydroimplantation was done, so there was a very minimal need to remove visco from anterior chamber, and after that wound closure was done. Now I'll be presenting the second case. This is in high magnification. As you can see, there is a good glow and good contrast. So after making two side ports, directly I injected visco in the anterior chamber. Why I have taken this case was the reason because initially when I tried to make the trench, instead of holding, I was eating the nuclear material and I was unable to hold. So let's see what I did in this case. So after injecting visco, the rhexis was made again using Utrata's forceps, and it is very easy to lift the first flap just by rubbing the anterior capsule gently with both the limbs closed and gently create the rhexis, leave, hold near the base, again rotate, leave again, catch near the base again, and see I'm struggling, so I used visco at this point. So visco unfolds the flap while making rhexis. See, the fold flap was unfolded and now it becomes easy to catch the flap, and I completed my rhexis. And you have to be gentle in all your movements, and see the rhexis was completed. Now hydro was done. You can watch the fluid wave behind, and tapping in between is always required to displace any entrapped fluid behind. Then gentle dialing with free rotation of the nucleus with phaco probe. I enter the anterior chamber and see I would be making this trench. The trench is small and deep, and you should always aim for a small and deep trench as I recommend in all my videos. And then you can see I had an ample lens material in front to hold, but as I go I end up emulsifying that piece, and see I was unsuccessful, so I decided to enlarge in my trench more, and now manual cracking with the help of phaco probe and chopper, and very nicely you can see both the pieces were separated, and now you can again try and hold, and I could maintain that hold and took that piece out and emulsified. Similarly, other pieces were emulsified by holding and emulsifying them by bringing them into the central safe zone. Rotate the nucleus, bring the piece in front. See again when I try to hold. Then with soft nucleus, generally what happens is if you get a good crack, one of the pieces generally lifts up and it becomes easy to emulsify. And again, as you can see, all the pieces were emulsified, and now what is left is the cortical material. This leftover cortex was aspirated with the help of irrigation and aspiration cannula. This bimanual irrigation and aspiration is generally quite safe. This maintains the anterior chamber, and if your rhexis is intact, then there is a very minimal chance that you will catch the capsule. And why it is said that you hold and bring it to the center and peel, because probably if you will catch the capsule, you won't be able to peel it to the center and you'll feel that traction. So in that case, take a look whether it's the cortex or the capsule, and if you could peel it easily towards the center, probably it's the cortex only. So you can see now some amount of material was there in the PC, which was polished and removed. These fibers were removed again in the polishing mode because they are directly, you are rubbing the posterior capsule. And now as you can see, the rexus is visible clearly with all the cortex aspirated and polishing done. IOL was implanted by hydroimplantation technique, and the leading haptic went into the bag, and again the trailing part of the lens was depressed, and the trailing haptic unfolded and went into the bag. And again you can see that the lens is nicely implanted within the bag with rexus margins covering the IOL all through 360 degrees, and finally wound closure by doing hydro. Thank you for watching this video.